Hi everyone, my name is Elizabeth. I'm a third year student in the Masters of Physician Assistant Studies program. I thought I'd take you guys along for a day in the life of a clinical year student. Myself right now, I am on my emergency medicine rotation. So my shift today is from 8 to 8. So a 12-hour day is kind of typical for an emergency medicine healthcare provider. Kind of the perks of that shift is that you don't necessarily do that every day. So this week I only come in 3 days a week, Wednesday, Thursday, and Saturday. So today I am at the Fall River location, Charlton Memorial Hospital, and I'll take you guys along on my day and kind of talk about what I do as a student here, what I bring with me every day, and just some of my experiences. So I'll keep filming. So here's the entrance to the emergency room, and we're looking right now at the helicopter pad. So the helipad is used for different med flights. If a patient is unstable here in the emergency room or on any of the services, then they get med flighted out, probably to Boston, to whatever hospital has availability, or if they're coming from a community hospital that didn't have enough resources, they get helicoptered in here and treated at Charlton. So this is our emergency entrance. I come in here and I'll start my shift by going and getting some coffee and probably some breakfast. So as far as what I wear to clinical most days, I have my own scrubs on and pretty much a sweatshirt. So we're not really required to wear our white coats at this location, but some preceptors, prefer that you do. Sometimes, it's a more professional look. In the emergency room setting, you never know what you're gonna have, whether you can get something on it, stain it. It tends to just get in the way. So I wear my own scrubs every day, I wear my badge, and I'll show you what I bring with me into every patient encounter. Hi guys, so I wanted to just do a quick little video of the things I have with me for every patient encounter, things I bring with me every day into the emergency department. So first off is my stethoscope. I use the Littman Cardiology. This was a gift for me, but our program provides you with a medical equipment bag, and a stethoscope from Welsh Allen Company is included in that. So at your start of your second year in the graduate program, you can look forward to that. I also have this little clipboard that I bring with me into every patient encounter. I just attach little free-floating pieces of paper to it and take good notes on when I'm discussing the patient, why they're here, what they've been feeling, what they've tried to relieve their pain, different important little notes that I have to put in their chart later. I like to write down with me in the room so I don't forget them. This is a little quick medical reference book. It's really cheap, and it also comes with a membership to the AAPA, which is the Association of Physician Assistants. So this little book has everything from like normal lab value reference points to how to write a good note, whether it be an admission note, a discharge note, a progress note, an op note, and just different physical exam, little tips and tricks, different, reminders on anatomy, the nerves, the dermatome. So I like to just keep this in my bag, and if there's something, that I want to remember quick, or before I ask my preceptor I'd like to check on, then I can pull this out, and it's really easy and quick. This is our little competency book. So in the program in clinical year, you have certain skills that you need to complete out on clinical rotations. Some of them that I've gotten checked off here in the emergency room include like IV insertion, blood draw, an intramuscular injection, incision and drainage of an abscess, things like that, vein puncture, surgical suture, staple placement for like a scalp laceration. So just cool little procedural things that we have to get checked off by the end of our clinical year. And lastly, these tools. So this is an otoscope and this is an ophthalmoscope. So these attachments and these tools are also included in the medical equipment bag that we get as second year students. And we practice using them on each other in lab so that we get comfortable with how we use them. This is a really awesome and very expensive tool, so it's really great that we have it with us on rotations, because I'll say that in the emergency room here, they don't even have this set up. They have what they call a fundoscope, which I find it more difficult to examine patients' eyes in detail with those So I bring my own and I use it on the patients. I just used it this morning. So this end goes on the patient's eye, this goes on yours, and you can look right into their pupil and see the back of their eye and any concerning lesions they might have. This has multiple attachments. You can be looking in a patient's ears with them. You can be looking in the nose for any nosebleeds, the back of the throat. So those are things I like to keep on hand because you never know if the room you're walking into has them, if they're charged, or if you lost power or anything. You have them right here and they're all charged up and ready to go. Hi guys, so I'm taking my lunch break now. I had a good busy morning in the ED. I thought I'd share a little bit about what I saw and how it kind of goes with being a student in the emergency department. So basically I'm paired with a preceptor, we call them. It's like our teacher who is responsible for us and we report to on each rotation. So I'm paired with a PA who works in the ED and I'm with her every day, every shift. And so how our day kind of goes is that she sends me in with the patients that she's in charge of, and I go in and get what we call their history of present illness, or their HPI. It's basically the story of what brought them in today, what they're feeling, how we can help them. I go and give a verbal report to her and basically sum up my conversation with the patient, and then I kind of offer up my own thoughts as to, what could be causing their symptoms and what we should do with them while they're here in the ED. And then it's kind of up to us to figure out if they are someone who needs to be admitted to the hospital for further workup, if they can be treated in the emergency department and sent home on their way, discharged home. So that's basically kind of how we operate down here. And as a student, I get to do a lot of, good history taking, good physical exams, and procedural skills. So I get really comfortable with suturing lacerations, doing incision and drainages of abscesses. I do staple placement on like scalp lacerations. I swab for COVID, for flu, for strep. Nasogastric tube placement is an NG tube that goes in your nose and down to their stomach to help relieve bloating if someone has something like a small bowel obstruction. So these are all things that students in the PA program who are out on their clinical rotations gets to practice and be part of as a student in the ED. So I'll see what my morning brings and see if there's anything interesting. So far we've had a few patients with abdominal pain, appendicitis, pancreatitis, a few patients with chest pain that we work up for cardiac cause. Let's see, we had a flu, we had an ear pain. So these are all just really common complaints that come into the ED that we are prepared to deal with. So I'll see what the afternoon brings and go from there. So I'm headed up on my dinner break. Here's the cafeteria. Just show you some things that we normally have. Whole prepared food section with salads and sandwiches, hot bar for any honey muffins, salad bar, and coffee cup. All right, so I'm headed home for the day. My shift in the ED is all done. It's 8 o'clock. We had some really great cases in the afternoon. It was a busy afternoon. We had a trauma come in who was unresponsive in diabetic ketoacidosis. We had a patient who needed a splinting of her right hand. She broke one of her fingers. We had 2 people who had lacerations that required suturing, one on the back of their head, one on their eyebrow. So got some good practice with those. So all in all, really great day, a lot of variety. You never know what you're gonna get in the ED, which is why I've been enjoying it so much. And I'll be back again on Saturday morning and we'll do it all again. So thanks for coming along with me on my day today and wish you guys the best of luck.